First topic of this morning is how to smoothen the adoption of AIT by implementing change management strategies. Let me first of all introduce the first panel for this morning. We have Dr. Mohamed Shamji coming from the United Kingdom, Claus Bachert, who is a doctor in Belgium, Walter Canonica from Italy, Jean Bousquet from France, and we also have a patient in the middle, that's Sébastien de Boer. First of all, let's have a look at what the discussion will be about, and I give the floor to Mohamed Shamji to give us an introduction.
Thank you, Bjorn. Good morning, ladies and gentlemen. It's a pleasure and privilege to participate and contribute to this EUFOREA-led respiratory future debates, which particularly focuses on how to smoothen the adoption of allergen immunotherapy by implementation change management strategies. Now, when we think about allergen immunotherapy, we know that it's highly effective in allergic rhinitis patients. It is associated with reduction in symptoms, need of rescue medications, and improvement of quality of life. And most importantly, it confers long-term clinical benefit after discontinuation of treatment. Now, what's really important for us is that when we think it's really noteworthy to consider that patients with allergic rhinitis are substantial. There's with a prevalence of 20 to 25% in the EU, and this pool of patients is increasing. And these patients, these symptomatic patients, are either receiving treatment or not receiving treatment, and most or the majority of them actually have delays of accessing relevant treatment. And it's expected that this pool of patients is likely to increase to up to 30 to 35%, and this is purely due to global demographic developments such as population growth. And within these uncontrolled patients of 30 to 35%, it's highly likely that 10 to 15% of those patients are more likely to be relevant for allergen-specific immunotherapy. And when we think about this, is in order to gradually reduce the patient pool, one needs to really accelerate better adoption, particularly thinking about allergic patients, and to smoothen the adoption of allergen immunotherapy for allergic rhinitis and asthma. So what are the real challenges? Well, there are three main types of barriers or opportunities. The first one is relevant in terms of thinking about the evidence. So this is a therapy adoption pyramid. So the first one is we're thinking about clinical evidence, and this really demonstrates, we need to really demonstrate the clinical efficacy of allergen immunotherapy, and in terms of its effectiveness particularly. The second part is the health economic evidence. This is really thinking about the cost effectiveness, which then relates to efficacy and involves reimbursement. The third and the most challenging one is healthcare practice. How can we really adopt allergen immunotherapy and think about integrating that into our daily practice? And that's really the main challenges. We think that we have met the first challenge, which is achieving clinical evidence. We know that immunotherapy is effective, whether it's given subcutaneously or sublingually. The second challenge, which involves health economics, is also quite relevant, but we've just partially met that criteria in a sense because some countries do reimburse and others don't. So we need to really work hard and ensure that we are the cost effectiveness is associated with the efficacy, and then that can be then translated in terms of reimbursement to then help integration in terms of healthcare practice. And the third one, which is the most important one, is where we really need to work hard integrately, and really in order to achieve the first. The top part of this challenge, there are potentially 4 solutions, and these are to think about prevention, diagnosis, treatment, and follow-up. So prevention really involves having timely access of treatment to patients with allergic rhinitis, without asthma, in a timely manner, particularly those with allergic rhinitis, to be able to prevent development of asthma. And this really involves education of our clinical colleagues, but also patients' awareness And also thinking about the novel tools that we have. These are integrated tools such as digital tools. We have the allergy dairy apps. We have the allergic rhinitis online platforms. And I think all of that together is really important to achieve that first step. The second step involves thinking about the particularly focusing on efficacy of treatment and how do we integrate that into our daily practice. So simplification of guidelines is really important. Adherence to guidelines, so implementation of those guidelines and then adhering to that is also important from our clinical colleagues. But what's also important is awareness from the patient's perspective, where they can also really adhere to their treatment, because at the end of the day, compliance is what really matters. So it's really important education from both aspects, from our physician, but also our patients. And then the use of online tools, digital platforms, which will then help support that aspect. And the third aspect is monitoring our patients. So with performing or giving immunotherapy in daily practice, we will be able to gather more clinical evidence, which will then relate to boost the evidence of health economic or cost effectiveness. And this really, again, is a collaboration between our physician, our patients, but also thinking about what platforms are available to really dissipate that within the daily practice or clinical practice. And last but not least, what's really important is to think about how do we facilitate this particular process, and this involves collaboration. This involves going out of our way and making sure and trying to facilitate the necessary need of our patients, and thinking about how can we ensure that there is a smooth sequence of care and delivery steps. And this may well involve a multidisciplinary integrated tracking care pathways. And I think if we can achieve all these 4 steps, we will be a step further than what we are today in terms of bringing allergen immunotherapy into your clinical practice. With this, I would like to hand over to you, Bjorn.